Hey, Hardin County, it's Michelle Labus, and I am still reporting on February 24th. I just happened to go over to the health department. I wanted to get caught up on kind of where they're at and how things are going. And so I had a wonderful conversation with Dion. She's great. She has just done an amazing job with the health department, keeping it together, bringing in these reductions in costs so that they are somewhat sustainable. So she was gracious to sit down with me. And then I found out there was a health board meeting that evening. So I got to go to the health board meeting too. And if you've ever been to a health board meeting, they're kind of long. And so, we went to that and it was great. So I got to see everybody at the health board and that was wonderful. And like I said, I just really want to commend the health board from when we started 2 years ago. Getting involved in government and seeing how things are working. There was some really tough situations. They kind of ran out of money. They lost a lot of people. They had to go to commissioners for help. Thank goodness the commissioners gave them the help that they needed, which is kind of in a roundabout way, kind of the commissioner's faults, the budget commission, because they had reduced the carryover that the health department could carry, so you kind of have your budget and then you have how much you can kind of keep in savings year over year, and they kept bringing that down smaller and smaller to the point where they only had 3 months of carryover. Well, they ended up with these TB cases and they had a lot of expenditures and they didn't, so then they got in a situation where the 3 months didn't get them through the rainy day, right? Because you need more than 3 months. And so they got in a real situation. The commissioners were able to give them $150,000, which was kind of, the idea was that they were going to use it for that next year, but a lot of things have changed, right? So they lost the director of nursing, and so she's not there, so you save on that salary. Dion is the fiscal officer, and she took on the health commissioner's position, so which they don't get raises over there. I mean, these people really do these jobs because they feel like it's a service to the community, because they're not getting raises like everybody else, because dollars are really tight. And so they lost a lot of people. I mean, they just had another lady, their accreditation lady, just moved on, and so they have shrunk their staff really almost to the minimum, and so that has saved a lot. So they've been able to take that $150,000 and keep it going, and now they haven't actually had to use it, but having it there as a safeguard is always a good thing. So they're moving forward. They are going to have to eventually do a health commissioner type job, or maybe fiscal officer. I don't know. Dion's going to have to separate her roles in one way or another, but just kudos to them. I think they've really done a good job. Also, at the board meeting, they have new bylaws, and so they've been able to make some changes in their bylaws, which is great. I mean, because that's part of how they kind of got into the mess, is they didn't have updates. Their board wasn't working really well, and so they got new board members. But anybody who's been on a board knows that it takes years sometimes to get things turned around, because you get new board members, they have to learn the ropes, they have to learn what's important, and then get the paperwork and the structure back in line for what's needed. Okay, the other thing, so congratulations to the board. They have stuck it out. They're doing everything that they can to get things moving forward. The other thing that is a big deal is that I think the Ohio Department of Health has realized that they have put so many regulations on our health departments that it's unsustainable. I mean, we have accreditation that you have to apply for a grant to have a full-time person who does just accreditation. Now, if you have to have a whole full-time person to do accreditation and it costs you $5,000 a year, what is the accreditation? I mean, it's just a bunch of paperwork. So ODH has kind of said, we made a mistake. We're not, the rules from 2022 we're changing them, and we're going to make it to 26. So we've got new rules coming out that are less document heavy. It lightens up the load on a lot of things. And we were supposed to do accreditation this year, and there's no way we were going to meet it. I mean, we didn't have the programs. Our health department has lost a lot of programs to the community health center that's just down south of town there. Pharmacies and Walmart and all those places do vaccines, so that's something that they used to do. They used to do the school nursing programs, but that fell through, and then the schools got their own nursing programs, which is great. But there's been a whittling away of what the health department offers programs, and that's how they kind of got paid, right? And then you get slammed with all these unfunded mandates, kind of like the fun things where the ODH says, oh, hey, you need to go treat all these TB patients, but we're not really going to pay you to do it. And you need to go do this and this and this and this, but there's no funding for it. And so you're spending man hours and time and resources for something that doesn't generate any income. And that's kind of where we were at the base of it. And then they instituted this new program where you can go get birth certificates and death certificates online, right? And you don't have to, before you'd have to go to the county of origin to request it. And it's nice because you have a person face-to-face interaction and you're able to make changes. Well, now it's all online. So our county, even though they're issuing birth certificates and death certificates, we're not actually getting paid for it. So the one source of good revenue that we did have is now gone. And of course the system's kind of crazy and it's down all the time. And so it makes it really difficult for people. And so not only do we have all the unfunded mandates, but the source of revenue that we did have now is gone. And, so it's just a big mess. I think they realize that they've put everybody in a hard situation. So we were supposed to get accreditation, and that has been pushed off for a year. And we're going to be able to get accreditation with the 26 rules, right? So they have different standards than the old ones. And so kind of figuring out what that looks like. And, we tried to get help from other counties, like Logan County, like come in and do these different programs. Well, they don't have time. They're in the same crunch as everybody else. And so, this is a Hardin County problem, but it is also a state problem. This is something that the Ohio Department of Health has kind of got themselves into with all these requirements, and we're suffering for it because we have to pay for the department. So last year they hadn't raised their rates for a really long time. They get paid from the city, the Kenton city, and through the townships. So they have the Township Association. And last year they raised it 10%, right? They really needed 30% to make their budget, and they didn't get that. And so then they had to go to the commissioners. But they raised it 10%. So now this year they're going to come back and they're going to ask for another 10%. And then really the third year they're going to come back and ask for another 10% because they needed the 30 to make it sustainable. And here's part of the reason why it has to be sustainable is that you have 4 people that are required by the health department. I'm not going to remember them. It's the director of nursing, the health commissioner, a clerk, and I think there's a doctor on there. And then you have an epidemiologist that is shared by different people. And you just pay kind of your stipend for the year for that epidemiologist. So you're required to have these people and you're required to pay them. And so you just have that upfront cost of those positions. And then you have to have, it's the director of sanitation is the other one that you have to have. So anyways, so there's a framework that just says, here is your your base amount. And if you can't cover that, then you've got problems, let alone people in the office working and all those other things. And so some of the things, those are some of the things that are changing. I mean, I'm really encouraged by the updates that they're doing, and they hopefully will go to the townships and be able to get an increase. And then hopefully the whole Ohio structure can change. I would love to see our health department become more local minded. They did get to start up the car seat program again. And so they've got a certified car seat person and car seats available, which is a huge program for us. Of course, the sanitation and food inspection and those kinds of things are really big and important, right? We just had a sewer conversation about root. And so we know how important that position is. And so I'd like to see it increase and become more efficient sometime down the road. What was the other program Dion was talking about? Because I had asked her, I was like, what does Hardin County need from the health department? Oh, so here's another thing that they also have Kevin does the emergency preparedness work there for the health department. And there is some talk, right? So if you follow along, EMA, emergency management, they brought in the LEPC underneath them. So under Keith Severance and Abe, right? And so there's maybe some talk, like maybe the emergency preparedness person from the health department will go over to the EMA and kind of become part of them. I don't know. Maybe EMA will take over the health department, and maybe there'll be a big restructuring. You kind of never know, especially with the EMA changing so much, with like Red Cross is gone, and the FEMA money is going to be gone. And so everything that was kind of federal is now going to be coming down local for EMA. Maybe the same thing's going to be happening. Maybe it'd be a big restructure. So anyways, still, it's a work in progress, and they are making progress. The bad news is that they still don't have programs that, that's the other one I remembered. So they did get a new director of nursing, and they say she's really, really great. I got to meet her the other day. I think her name's Bai, and she's been doing a great job. We have the CMH program, which is the complex medical, like kids with complex medical needs. And so she can kind of reimburse some of her salary. So she has to be part of the health department, right? So it's like you have to have this person, but now she can go out and provide services for our community, for people who need the nurse to come in and provide these services. And then she can get billed back from like insurance and those kinds of things. And so they're building up that program, which she's doing great already. I mean, she was talking about billing 371 claims, for $6,000, and she's just getting it up and running. And so really doing a great job. And they said that program can take a year to get really rolling. And so not only would it be great for income for our health department, but services for our community. So really excited about that. So anyways, here's another thing. I don't want to make this video too long, but here's a thing that shows you kind of the idiocracy with some of these rules. We had TB patients, which are usually non-speaking, can be non-speaking patients. TB patients come in. We were able to finish treatment for one of the patients, and I guess they were complicated. Like you could have like $5,000 cases where it's not complicated. And then you can have upwards of $25,000 cases where it is very complicated. Now, we had those kinds of cases where, you're going out, I don't even know, 3 times a day. Was it 3 times a day? Once a day? I don't know. It was a ton because you have to actually be there to watch the person take the medicine because it's an infectious disease with tuberculosis. And so we were sending our people out there. They're going, working with the person, and we're using all our time and resources to, you know, up to that like $25,000. So we finished the treatment of the one person. They got the reimbursement. Guess what? It was like $1,700. Right? Like we just spent an equivalent of $25,000, and they were like, oh, we're going to give you $1,700 to reimburse that, because basically the CDC gave Ohio like a set amount of money, and then they just divvied it out to everybody that had a case. And you just got a really small pie of it. The bad news is that we had the other case, but the person didn't finish their treatment. They moved on to another thing, and they were like 6 weeks from being finished, and then they decided to move. Well, you got no money for that. So again, upwards of $20,000, $25,000, and you didn't even get the $1,700, and because you didn't finish the treatment. And you're like, but that's not even our fault, right? And so those are unclaimed, mandated services that aren't funded, and you didn't even get any reimbursement from the CD for it. And so really a hard pill to swallow. That's funny, but it's kind of the facts of how it works, and why the health department, especially with these TB cases, really got themselves into a hard situation that wasn't necessarily their own. Not that the health department is perfect. They have, you know, a long way to go, but I am definitely seeing improvements, and so good for them. Other than that, I can't think of too much, but I mean, like I said, it was a long meeting, and they did lots of things, and they've got their meeting note or their meeting times set. So if you want to find out when they're meeting so that you can go and learn, that'd be great. So anyways, we'll talk to you later, Hardin County. See ya.